Kia ora and welcome to another Physiotherapy Board Te Poari Tiaki Tinana podcast. In this episode, Board Te Poari Chief Professional Advisor Damon Newrick talks to Dr. Karaitiana Taiuru about Māori data sovereignty in the context of digital health. Dr. Taiuru, Director of Taiuru Associates, is one of Aotearoa New Zealand's leading voices on Māori data sovereignty and digital technology ethics. He works at the intersection of tikanga Māori, mātauranga Māori and emerging technologies, helping organisations govern AI in ways that prevent bias, protect rights and build public trust. The conversation was recorded on Friday the 20th of March 2026.
Kia ora, welcome. We're joined today by Dr. Karaitiana Taiuru here in Punake and talking about Māori data sovereignty, digital health and AI. So welcome. Thanks for joining us.
Thank you. My pleasure.
I've had a question for a while since we last worked together on the webinar, which was where did you start with AI and digital health and colliding with Māori data sovereignty?
I've been in the IT industry for about 30 years. Maybe 15 years ago, data sovereignty became a topic. And immediately, I noted that data sovereignty is a big issue. It relies on privacy, it relies on intellectual property. When digital health started becoming quite common, it was really obvious to me that data sovereignty was really important for digital health, simply for the fact that our health data is so precious. It's so important to us as individuals. It's our identity. It basically it's everything about our health, right? And it's also a prime tool for hackers to steal, to commercialize and create a lot of issues.
Wow. For those coming to the journey early on, how would you explain Māori data sovereignty?
Yeah, so I'd start off, so in New Zealand here we have Te Tiriti o Waitangi, the Treaty of Waitangi, and that talks about a relationship between the Crown and Māori, inequities. But Article 2 talks about Māori have the right to govern their own treasures. So Māori believe that data is a taonga. And of course, I think most of us understand that data is a treasure, is a taonga. It's, we need data to live in this world. So data sovereignty just means that Māoris have some authority or co-governance with data, how it's used, where it's stored, and basically, ensuring that data is not biased against Māori.
What are some of the things coming with that, obviously with worlds colliding and digital health, that make that challenge that? And I know you spoke earlier about things being stored overseas or losing things overseas.
Yes. So one of the key principles is making sure the data is in New Zealand. But obviously with digital health, that's not always feasible. We don't have the infrastructure. We don't have the storage facilities. But when we can, it should come back, be repatriated back to New Zealand. And that gives us protections. Our most vulnerable data is our health data. So if it's in New Zealand, under New Zealand jurisdiction, where we can control access to it a lot more easier than if it's overseas. When it's overseas, there's a number of risks. We've got a number of external people can access our data without us knowing it. It can be sold in mergers. It can be used inappropriately. So because it's not governed by New Zealand law.
We spoke also before we go on camera about genomes and things like that, and that often, and since I was young as well, things like heads, body parts are being repatriated. So we've got this whole new world with genome sequences and things, and fluids and bodily specimens being taken overseas and left there.
Yeah, that's a real concern. And I know for a fact a lot of older Māori people will not go to the hospital, will not go to a health provider if they know their body fluids or samples are being taken overseas. Because from a Te Ao Māori perspective, that's still part of you. It's, and of course we repatriate Māori heads from museums, we repatriate other Māori artifacts. But when it comes to health data, such as biological health data, it stays overseas without any control. More progressive health researchers will actually ask for it to come back and have a Māori data sovereignty clause in the contracts with overseas providers.
Which is really interesting because when we first started working together around the digital health standard, and I still, on a lot of levels, thought of data as being ones and zeros being put out there into the ether, but there's a lot more to it than just that.
Yes, most definitely. So basic digital data is just a modern form of our traditional data, which is carvings, images, waiata, haka, words. It's evolving.
Because in that healthcare setting, there is, and I think about consultations that I've done, there is an awful lot of data being transferred, being talked about, being discussed, and it's a real challenge for physiotherapists to know where to start. So how would you say, how do those conversations start in say, in clinical practice, where you're telling people what's happening with your data?
Yeah, I think it's first important to understand, for the health providers to understand the basics of what's happening to the data, and then to be able to say to the patients, yep, this is your data's going, X, Y, and Z. These are the organisations who have access to it. Here's the potential harms, and here's all the benefits. Are you okay with this? I think is the most appropriate way to do that.
And that really speaks to informed consent, doesn't it? If the information is like other parts of informed consent we talk about in healthcare, if the information is there, you then have a choice, as opposed to being told afterwards what happened to your data, and unfortunately it's now gone and someone else is using it. What challenges and I'm thinking about scribe tools, I'm thinking about similar types of even triage tools. What challenges does AI bring to the fore in terms of Māori data sovereignty and New Zealand data sovereignty?
Yeah, so I think that some of the big issues that I am seeing is that the AI is trained on American data. So just our vocabulary is very different to American vocabulary. Then we've got the differences with Māori words, which are probably not going to be recognised. We see transcribing equipment having issues with Māori language, picking it up properly. Then we know that a lot of transcribing technologies keep the data that it hears, and so it can learn and train. So we're giving away some of our well, I think there's risks there if we're talking about highly sensitive health information that's going into an overseas company, and what's going to happen to that data?
And for the systems that are already there, biases within it that are meaning that are challenges for health equity?
Yeah, most definitely. So again, the health data is usually trained on European data sets. And so we know that medically, Māori Pacifica people have different genes, different health issues, different physical structures. So, there's a real need to balance up the difference in data and make sure that it is fair and equitable. And one way to do that is always making sure there's a human in the loop with anything that comes out of the AI. Just double check and fact check what the AI is saying.
Yeah, been caught out there myself in the past. So if you had some advice for maybe for physiotherapists working on the front line and clinicians working, what would you say is, in terms of Māori data sovereignty, and trying to do the right thing and trying to, is informed consent probably a large part of it? Yeah,
informed consent is a large part, and just being culturally aware. Typically, younger Māori probably don't too worried about where the data is going, about cultural practices. I think the older Māori are probably more worried about cultural practices and definitely about informed consent. And there's a lot of misinformation out there, so just being prepared to combat some of that.
I liked but didn't like what you said earlier about probably the barriers to service. Again, with Māori often Pacifica, he was being worried about what is happening with that data and therefore avoiding using services. Is there a way that, do you think New Zealand has a job to get that misinformation out of the way so that actually people are finding out what is real and what's not?
Yeah, most definitely. There's a I guess the health profession has a responsibility to try and combat some of that, as do Māori communities. We've got responsibilities to upskill and battle misinformation ourselves as well.
For the physios working maybe in a different area, maybe in academia, and I know research is an area you've worked in, I've always found that research participants have always usually been reasonably well informed. But again, is that another area where it's becoming a challenge when we're analysing results afterwards using AI? We think we're sticking in a table of data and actually we've now lost that control of that data.
Yeah, that's a serious issue that does continue to happen. And it gets to the point, well, if you're going to disclose it in the patient's information packs for the research, it could end up being 20 or 30 pages long, and who's actually going to read that? Probably not anyone. So I think just having a high level understanding of where the data's going, who has access to it, what are the risks. So.
Yeah. The understanding of by physiotherapists, I think, is key for us. Is the thing which, as a physio, I've got a responsibility to know what system I'm using rather than just grabbing the new shiny tool off the cab of the rack. Is it similar to other internet or digital tools where sometimes if it's a free tool, sometimes you're the one who's sort of driving it, and actually sometimes paywall versions can be better with sort of creating walls around where the data goes?
Yeah, so the general rule is if you're not paying for it, you're paying for it with your own data. So you're sharing all your private data for payment. If you're paying for an AI service, probably read the terms and conditions. They vary greatly. But I think if you're going to use an AI, on-premise AI is probably the most secure form of using AI, is when your organisation has the AI in-house on their own servers, so it doesn't leave. But,
yeah. That's the thing that surprised me most when you spoke about it earlier today was the way that the data can be used retrospectively too, with changes, say, with ChatGPT and the US government.
Yes.
What's happening there?
Yeah, so just this week, ChatGPT agreed to let the American government have full access to the AI systems for surveillance of their own people. So basically anything that anyone in the world has put into ChatGPT is now being used to assist state surveillance and, unfortunately, assist in the wars that America's involved with right now. And we do know from the media and from the American government that things such as facial recognition technology have been used with weapons in different countries. And they've got massive profiles of their own people, what they've been asking ChatGPT to do over the last few years.
It's really funny when you're sitting in your office and you're not thinking about that when you're putting someone's health data into, you're putting some data in about where it can possibly end up. I was certainly ignorant to that for quite some time. Any final words for physiotherapists out there with Māori data sovereignty? I think there is a little bit of a fear out there for those who are new to data sovereignty about doing the wrong thing. What would you encourage them to do?
Ask questions. Don't be afraid. I think the important lessons are informed consent, where possible. Use New Zealand tech, but also it's not always practical and it's not always possible. But I think as a country we're on a journey. And literally, Māori data sovereignty is good for all New Zealanders, especially in today's political environment, where if we recognise and implement Māori data sovereignty in New Zealand, or New Zealand data sovereignty, then we have control over our data, and we're not at the risk of losing our data overnight.
Kia ora. Kia ora. Thank you very much for your time. Thank you.
This has been a Physiotherapy Board Te Poari Tiaki Tinana podcast. It was recorded on Friday the 20th of March 2026 and featured Board Te Poari Chief Professional Advisor Damon Newrick in conversation with Dr. Karaitiana Taiuru, Director of Taiuru Associates. To receive our podcast episodes automatically, you can subscribe to us wherever you normally find your podcasts. As always, if you want to share your thoughts about this episode with us, you can email us at physio@physioboard.org.nz. Kia ora.